Hi, everyone. Welcome to our panel today entitled Designing How We Work Together. We're really excited to have you all here with us. The panel today is brought to you by Connect the Dots, and that's me, and by Brady Halligan from Navigate. We've brought together a really interesting group of people that are change makers and doers in the city that are really focused at the moment on new ways that we can work together. Particularly in the times of COVID, we've all been trying to reimagine what are the best ways to engage stakeholders, make insight-driven decisions, make empathy actionable. So what we've done today is bring together people from a variety of different perspectives, from government, from healthcare, from medicine, from corporate, to really explore how we're each approaching the challenges that come with reimagining engagement and reimagining collaboration during this time. Particularly Connect the Dots is one of the creators of this event, and Connect the Dots is my company, and it is a stakeholder engagement firm. So we're really focused on bringing together, again, people from different sectors, from community, private and public sector, to reimagine cities and towns. And particularly, we've been looking at how do we bring together stakeholders in a way that's really equitable right now, that's really robust, and allows for reimagining of our communities in a way that reflects what people actually want to see in their cities. So in light of this panel, we really thought it'd be interesting to, again, bring together these different perspectives, the different people we meet through our work and that we work with through our different projects, and kind of have that magic that happens when we bring it all together and see how we all can fit in together and reimagine this. So I'll move you over to Brady now, who's going to introduce Navigate and more about the reasoning for this panel today.
Cool. Thanks, Marissa. Hi, everyone. Thanks again for joining us today. My name is Brady Halligan. And first off, I want to just say how nice it is to have and to be at BPHL this year. And with this session, even though it's virtual, it's been a wild few months here. So this is just a refreshing sense of normalcy that I'm definitely craving. And hopefully this can, this session and the others throughout the next couple of days at BPHL can add some inspiration to drive us into the new year, hopefully. So this topic today of designing new ways we work and stakeholder engagement has been the main focus of my professional journey. My colleagues and I at Navigate, we work on this daily with our clients, helping large and complex companies solve complex problems through the way people work. So if you're not familiar with Navigate, we're a management consulting firm based here in Philadelphia. We help guide companies through operational model transformation, through merger integration, customer experience transformation, and digital and technology enablement, just to name our service areas. So through COVID, we've been working with companies and organizations to help with their disruptions and going through all the transformations that we've all been dealing with. But also internally, we've been going through a transformation of a rebranding kind. And so it gets me really excited because we have a new website, logo, fonts, all of that stuff, and someone with a design background. That gets me jazzed up. So check it out if you haven't already. It's navigatecorp.com. And for anybody, local Philly residents, sports fans, there's a video there that you might recognize a local Philly resident. So the discussion topic at hand today, stakeholder engagement and designing the new ways we work. This can get very complicated and complex pretty quickly. But if you really just take a step back and boil it down, organizations of all kinds are just masses of individuals. And the mindset of leaders, especially today, must be focused on extending the human potential and really enhancing the human-human connections and activating empathy internally, but also outside of your organization. This is not an easy task in today's data-heavy digital world with rapid disruptions, and even harder in COVID times when you have things like Zoom fatigue, longer work hours, conversations getting lost in the tsunami of emails, and then also leveraging not the right design tools and collaborative software. So this is why we wanted to have this conversation, because it is so important and even more critical to activate empathy and engage people in these new ways. So to kick off this conversation, I'm going to ask our amazing panel of speakers to introduce themselves, but also pose a question in kind of a lightning talk style. So I'm going to shift it over to our panel speakers, and you can see them here on the slide. And I'm going to pose a question. What does stakeholder engagement look like in your work? And with your response to the panel speakers, please introduce yourself, share a little bit about your work, and also a new, different, innovative way that you've had to evolve or shift the way you engage with your stakeholders. And stakeholders in this reference could be your customers, employees, colleagues, constituents, patients, all of the above. So with that, I'll point to Viraj, if you wouldn't mind starting us off and introducing yourself and answering the question. Thanks.
Thank you, Brady and Marissa. So I think the big thing for us, so my name is Viraj Patwardhan. I am the Vice President for Digital Design and Consumer Experience at Jefferson. I hope most of you know Jefferson, but at Jefferson is an academic medical center. So we have 14 hospitals and we have 2 universities. We have a medical school and a design school, which is pretty unique when you have a design school and a medical school working together. I think the past 6 months have been, to be honest, has been very challenging for healthcare, not from a perspective just as, being on the front lines and making sure that we are taking care of people. But the pandemic has put a lot of different challenges to us outside of that. One is that the conventional business models on how healthcare is run are completely challenged right now. And I think that goes a long way back as to how we would engage with our stakeholders. Primarily for Jefferson, we have 2 types of stakeholders. I would say 3. One is our patients, of course. Second, because we are an academic medical center, our students, they are one of the biggest stakeholders. And third, because we are almost 35,000 employees, that's a large enough segment where you can say they are stakeholders as well. Because if you don't have happy and content staff members, you can't expect them to deliver positive experiences. So I think that sort of, those are the 3 big stakeholders. So we had to address those in many different ways. My group or my team doesn't work on the front lines, but we did support them a lot. So the couple of things that we immediately realized sort of healthcare needs to do is, first is clear communication. In the world of virtual, it's not always true that we clearly communicate with each other. And that's partly because this is new to us, for everybody. We haven't done, before March 17th, I think that was the day when we started to go remote. For the most people in Philly around that time, we were doing online meetings, but they were probably 2 hours in a day or 3 hours in a day. But we were doing that from our office when we had 50 other people or 10 other people around us. Now you're sitting in this space where I am, and you have a similar space like that. And you start at around 8 o'clock because it's assumed that your travel time is now meeting time in the morning and in the evening. And so you kind of spend about 12 hours or 10 hours in that one single space. You get up, you try and do different things. So I think clear communication was one big thing. Allowing and understanding that technology mishaps can happen. People are not used to sit in front of TV. Like a screen for 10 hours. So there are going to be times when, your people are not going to be on the screen, or, you're going to be too close to the screen or far away from the screen. So allow for that. Make sure that you acknowledge that you probably could be doing that at some point as well. And people who are just nice, not pointing that out. So how do you work with your stakeholders? From a patient perspective, I think the biggest insight for, I think, most hospitals, including Jefferson, is how do you virtually communicate with your patient? Thankfully, we have been Jeff Connect, which is our telehealth program. We have been having the program for past 4 years. And so we were ready for something like this without even recognizing that we'll need something like this. So our visits, which were about, I think, 200, 250 a day, we suddenly went to about 4,000 visits a day, right? And that way, but we were prepared for it. The platform was prepared for it. So for us, it was, yes, we were always digital. We were trying to but I think it was time to embrace digital, because when people can travel to your hospital, when people can be in close proximity to you, you have to find different ways to make sure that you interact with your patients and you still guide them. You may not be able to physically examine them because they're not in front of you, but you can do so much more. We also started using the platform for anxiety management, or for people who are not feeling really, they may not be sick, but then there are other things that the pandemic has got to us, is people being alone, people not being able to mingle with each other. So that brings different types of challenges. And I think from a student perspective, the last 4 months have been, what can we do to make sure that we continue the same level of education that we had the previous year, but virtually? And for those who are not in the academic side, it might feel easy. You just get people in front of Zoom and, you deliver a lecture. Online learning has been there for a while, but if you have a university which is not used to online, now is moving into an online model, there are so many things that you need to change. We are not fully online, but we have our students back in our school. But I think it's also majority of the stuff that we do will be moved to online. So how do you balance that? How do you make sure that your students are safe? How do you make sure that on one hand, you make sure that you are dealing with the pandemic, and we have seen in many different cases where students were infected with COVID-19. So that's one. And on the other side, still continue the education or the level of education that you do. So I think for us, the biggest learning was that make sure that you clearly communicate. Make sure that you embrace digital, because if you don't embrace digital, you're still trying to do things over, even on a phone. That may not be the most wise thing today. And then the last thing is, at no point, you have to say that because I'm fully virtual, the emotion of the other person doesn't matter, or don't judge people based on what they're wearing, based on what, how they say certain things, because cameras can be elusive. You can, when you're next to some person, you can understand the facial expressions, but if someone's on phone, on a Zoom call, and you're not able to see them clearly. So don't judge just based on what people are saying, but be a little bit more patient and inclusive. Yeah. I think, Brady, you're on mute.
Okay, I'm going to start talking and hope that it's the right time. So, hi, everyone. I hope you can hear me. Thanks, Viraj, for that intro. I'm really glad that I get to follow you, because I think a lot about kind of what I want to briefly talk about really piggybacks off of some of your comments. So, hi, my name is Eliza Pollack. I'm the Director of Innovation for the City of Philadelphia. I sit on a small team called Innovation Management, which sits in a much bigger team called the Office of Innovation and Technology. Most of OIT really handles the city's technology infrastructure, and my group and kind of my immediate role on the team is to really kind of create and sustain a culture of innovation within municipal government. So really what that means is kind of shifting the paradigm away from one of people thinking that government is really bureaucratic and antiquated and a bunch of like old dudes sitting in the basement of a building using pens and pencils and fax machines, which definitely does happen. But, kind of how do we move away from that space and into a space of government is not just a consumer of innovation, but a driver of innovation as well. And really what that looks like for us primarily is around training and supporting and empowering city employees to be their own agents of innovation. So really, how are we creating systems and frameworks for city employees to really think differently about their work, about how they're solving challenges, really about how we're delivering services to be more efficient, more effective, but also really more creative, and I think a little more cutting edge kind of in the government space. So we have in the city, I think, just to state the obvious, two main stakeholders. We have internal city employees and external residents. I'm going to focus for now around kind of our internal stakeholder engagement, because I think that that's been a really important element kind of as we've made the pivot to this COVID virtual workspace. So one of the things that I do a lot in my role is facilitate workshops in a program that we call innovation consulting. So innovation consulting is kind of our version of honestly doing similar work to what Brady and Navigate do, but keeping those services in-house in city departments. So instead of a city department putting out an RFP to engage an external consulting firm, my team in innovation management will offer very similar services for free in-house. So it's using human-centered design thinking and kind of innovative tools to help city departments move the needle on challenges that they're facing. And in person, that involves a lot of really high engagement, highly collaborative workshops where we're sitting in groups and we're using flip chart paper and Post-its and colored markers. And I think kind of these very high touch tools that we're all probably pretty used to. The big challenge for me, and I think I'm guessing maybe many of you as well, is kind of how do you pivot that kind of engagement to the virtual space? And there are for sure lots of really fantastic platforms. I think there is Miro, there is Mural, all of these online spaces that are meant to help facilitate online collaboration. I, perhaps ironically though, have kind of chosen to take a very, very, very low tech route to facilitation and engagement. And I'm just going to kind of quickly lay out the 4 reasons why, because I think kind of an important element to what stakeholder engagement looks like in the COVID era. So when I say low tech, I quite literally mean I would be on a screen like this, and behind me there would be like an easel with a piece of flip chart paper. And I would be writing things on Post-its with markers, and everyone else would just kind of be an attendee engaging with me in conversation, kind of like your traditional Zoom call. So the reason that I've chosen to do things that way is, one, I think the digital fatigue in this space is very real. And when you're spending kind of hour after hour in front of a screen on Zoom and then on Teams and then on WebEx, it's a lot. And so from my perspective, if I can facilitate in a little bit of a lower engagement setting where someone just needs to look at the screen and talk to me like we were in person, I think it takes a little bit of that engagement pressure off of them from a whole day of what I know has been sitting in front of a computer. The second reason I like low tech is, quite honestly, it's just one more thing that you don't have to worry about going wrong. So I think we've all been in meetings where we've done a Zoom breakout and someone gets left out of their breakout room, or your internet cuts out in the middle and you can't manipulate your Post-its anymore. And so again, by keeping things pretty low tech and just having all the attendees in one room engaging with me, we really kind of minimize those technological hiccups. The third reason I like the low tech is quite honestly just personal preference around what my facilitation style and what my stakeholder engagement style is. And I think it's really important when you're in the stakeholder engagement space that you stay true to who you are and what your engagement style is, especially in the virtual space when we're dealing with some of those things that Viraj talked about, where you can't read body language, you can't see how people are feeling. We don't have those same kind of soft like body reads of how people are feeling about what you're saying. So for me, being able to facilitate in the virtual space as close to how I facilitate in person as possible, I think has really kind of continued to allow me to be the best facilitator and the best leader that I can. And then the fourth reason, which I think is the most important, Philadelphia has an absolutely tremendous and quite devastating digital divide. And the more high tech your stakeholder engagement gets, the fewer and fewer people who can kind of meaningfully and authentically and easily and literally engage with you. So when you start getting into more high-tech programs, like a Miro or a Mural, we're really relying on people to have a steady internet connection, a device that allows them to manipulate the screen, the digital literacy skills to understand and learn a new platform and use that platform in real time in order to engage. And those are hurdles that are really, really challenging for a lot of people in Philadelphia. So kind of by doing things as low tech as possible, I can have a really meaningful stakeholder engagement session where someone just calls in on the phone and they can more or less equally participate without worrying that they can't see something or they can't manipulate something. And I think that kind of doing things through this old school lens continues to create just a much more equitable playing field among the people that we're so often trying to engage with in these kinds of sessions. So I'm going to leave it at that. I know there's more to come. And I am going to pass this over to Lori, I believe. Lori.
Thanks, Eliza. Good afternoon, everyone. Viraj and Eliza did a great job, I think, in setting the platform for our discussion this afternoon. And I'm going to probably pivot in a slightly different direction than the previous two presenters. Again, my name is Laurie Corbin. I'm Managing Director for Community Engagement at Public Health Management Corporation. We're a very large nonprofit public health institute located here in the city of Philadelphia. Our mission is to create and sustain healthier communities. And with that, this includes engaging the community whenever and wherever possible. And we have a really broad definition of community because that really represents individuals, geographic locations, communities of like-minded individuals. And then that crosses the spectrums of three key stakeholder groups for us. First and foremost would be our employees, because as we look at the larger community, our employees are representative of that community. And they're going to be key for any success for the work that we do in terms of their engagement, also manifesting in larger stakeholder engagement. Second would be our members or our participants, or those for we provide services. As an organization, we work with some of the most vulnerable populations in the city of Philadelphia and the surrounding area. This includes those who are homeless, those who have addictions issues, families that are involved in child welfare, individuals with intellectual disabilities, as well as criminal justice involved folks. We also run and manage 5 federally qualified community health centers. So we are really in the crux of both social as well as healthcare services and here in the city of Philadelphia. And for many of our members or participants that we work with, they access probably at least 2 or more of our service complements in their engagement with us. So it's really important for us as we're working with the individuals and families that we're engaging them in a very robust way by getting feedback on a regular basis as to what's working well, what's not working well, and how we can continue to improve service delivery. And then the third stakeholder group for us are actually our funders, or those who we contract with. We have many contracts with the city of Philadelphia as well as federal and state government. And they have certain requirements and mandates to receive those funding. It's important that we're constantly having robust communication with them. We're engaging them in the work that we're doing to get feedback on a regular basis, because it is a synergy that we all build off one with each other. So, it's been said earlier that communication has been key as we've had to pivot in this realm of COVID-19, and communication for all 3 of those stakeholder groups were really essential for us. I'm not going to talk a lot about technology. I will say as an organization, we were actually on the technology front, we were actually able to pivot pretty quickly. We have staff who have laptops and cell phones and sort of are used to doing a lot of work, for lack of a better word, in the field or remotely anyway, pre-COVID, but it did require us to sort of ratchet things up to the next level. But one of the things that we were really concerned about were those individuals who, for example, came to us on site to receive services. And one of our programs in particular that I'm going to talk about, where we had to pivot in a slightly different direction, was one of our recovery management program, which is based in North Philadelphia, or treatment readiness program. This is a program that really works with some of the most vulnerable population, those who are homeless, those who have addictions issues, mental health concerns, issues of poverty. We are a haven in the midst of a community that is really impacted by poverty. We're located 2539 Germantown Avenue in the heart of North Philadelphia. But it is a sanctuary for many in those communities. People would come in, they would do groups, whether it was around your recovery, or you're trying to figure out how to do a resume, or you're trying to access real tangible services. We had to shut our doors by the end of March. And so with that, our staff that run that program were really concerned how they were going to be able to continue to engage our participants. We were also concerned about how we were going to continue to fulfill our mission and our support for that stakeholder group. So we did a combination of things. We started doing Zoom groups, because some of our participants have technology, and as Eliza said, but many of them don't. And some of them are not versed, or they may have a cell phone that may have a limited number of minutes. And so therefore they may have to choose between using those minutes to participate in a group at our treatment readiness program, or using those minutes to talk to their doctor about a chronic health condition. People are making those choices here at this time, but we wanted to have that available. We also, but at the same time, my team actually went out into the community. They went to homes and did wellness checks. They were really concerned about their individuals and what was going on. When there was food distribution that was being done throughout the city, when that initiated, our team members went to the food distribution sites, would get food for these families, these individuals, and take those to those homes, just to ensure that people had the basic things to live their day-to-day lives. We provided resource information about where people could get, rental assistance, or, other tangible services and support in light of COVID. We wanted to make sure that there was real-time information that was out there in the hands of people who needed it most. And then our employees, we've done a really good job of really keeping our employees updated and engaged corporate-wide. Through COVID-19, we have had town hall meetings on a regular basis to educate about COVID-19, as well as other topics of concern during this time. We actually had our employees use that information to also support the members or the participants in the community, including how to wear a mask, making sure that you're doing social distancing, making sure that you're doing hand washing. With this particular program, we even took out PPE to individuals just to ensure their safety and as they went around about their day-to-day lives. We knew that it was going to be important for us not to just sort of let these people not continue to be engaged with us during time, because it was too critical for their day-to-day really existence for some of the folks that we work with. So we've had to look at things in sort of a combination of how can we do some of these things remotely when technology and other means allow us to do it, but there is still that face-to-face work that has to happen for the work that we do on a regular basis. So I'm going to now turn this over to Shantae.
Programs that we're doing with the NFL, or what we're doing with Lyft or stream on Netflix. We also have a worldwide public sector section of Amazon Web Services as well, and that's where I work. And so my role is to really work with government leaders, such as Eliza, and to talk about how are we going to use cloud technology to improve government services, innovate, and deliver services differently to constituents. And so as you can imagine, during COVID-19, during the first days, a lot of governments really relied on our Amazon Web Services to deliver those services. People were not able to access the websites they needed to receive information about where they could go to get tested. They needed to go on the internet to watch the delivery addresses from the governor or the mayor or the county executive, and so what happens when those websites go down? And so they really relied on Amazon Web Services to provide that service to quickly get up and running so governments could deliver those services. So our stakeholder engagement really had to change very quickly. As you can imagine, we're a global company. Although I am located on the East Coast, I was working with customers on the West Coast. So I was used to being on a plane, a train, in my car. And, I think Eliza and I we can relate to each other because I'm an in-person type of presenter, right? So my colleagues we all often have a laugh because I'm running around with markers and sticky notes. I mean, I will pull everything out of my bag to deliver these hands-on sessions, but you don't have that ability when you're doing them online and you're doing them virtually. And so during COVID-19, again, those first early days, we really had to figure out how are we going to have that same level of interaction, that same level of getting deep and finding those root causes problems so we could get the governments up and running so they could deliver the services they needed very quickly. And so our stakeholder engagement, at least mine, has changed. And so Abel and I heard another speaker talk about, you can't see people sometimes body language. When you're delivering a presentation in person, you can tell when people are confused or when they're disengaged or when they really are about to ask a question. And sometimes that's hard to do when you have 20 people on we don't use Zoom at Amazon Web Services. We use a program called Chime, but it's very similar, your virtual experience. And so that is something that even myself, I've had to start looking at different ways to make sure that everybody is engaged. But I would say that there are 3 things that has really changed in our stakeholder engagement going to this new way that we're working with our customers. And the one is we can involve more people. So as you can imagine, sometimes when I'm traveling to meet a different customer, oftentimes on the East Coast and, or the West Coast, people's schedules are very hard to kind of align. And so we now have the ability to have more people involved in the process to discuss where we want to go next with the cloud technology. How do we want to start engaging the constituents in a different way for that customer? And before, maybe we would have only been able to get 1 or 2 people from that organization or that government into the room because schedules didn't match up. Well, now that we don't have travel time, we're able to get more people in the room and engage the stakeholders in a different way. And I'm also able to get colleagues who may be in a different time zone to also participate and lend that subject matter expertise to that customer that may not have been available before had we had to travel and line those schedules up. The second thing we're able to engage differently is we now have more touches. Again, because the schedules align differently, we can actually meet more often. Now, granted, there may be a doorbell ringing, a kid crawling on the floor, or a dog barking in the background, but we all in the same boat, so we get through it. But now we're able to meet a little more often, especially in the times that we're dealing with right now, where governments aren't now looking at just of getting up and running and teleworking and things of that nature. We're now looking into the future. So we're now planning long term. And again, having more engagement, having more meetings, although it makes our days a little longer. I'm trying to figure out how am I working more than I was and I've always been virtual. So I'm still trying to do the math on that one. But we're actually, again, having more engagement and actually seeing faster progress because we are able to meet more often. And the third thing, I think, is our innovation has changed. I think through COVID-19 and utilizing a different way to engage stakeholders, at least my government customers I'm working with are realizing the art of the possible with technology, and how technology can be used a different way. And Eliza brought up a great point. Is I think it really highlighted the digital divide. And it really highlighted that we took for granted that we could just jump on a Zoom call. But, Lori brought up again, if you don't have the ability to jump on that Zoom call, you can't participate, And so we really started forcing and really working with our customers and saying, hey, we have to start looking at different ways. And I think because all our government customers are in the same boat, of realizing what happens when you had to send an entire government home to work online and you had to get people, web access and you had to get them chairs and you had to get them everything else they needed. They realized what that digital divide actually really looks like because now they were experiencing not having the technology that they needed. And so our innovation has really, really grown with our stakeholders. and that we're now able to have different conversations because it now became real for everybody about what that stakeholder engagement looks like. And we're able to now work with our customers and realize stakeholder engagement is possibly bigger than we probably thought it was before. So although our stakeholder engagement has changed, I definitely think that it's created a different scenario that we all now can relate to. And I think we're coming out better for it. And I think, Brady, I'm kicking it back to you. Or Marissa.
But we now want to shift to our panel conversation. And so as we shift, we want to, Shantae, that was actually a perfect transition, talking about thinking into the future and future planning, and start to really realize a lot of these issues, understanding in how we're getting our heads out of the sand that is the COVID and start looking into the future. We have to start to consider signals of trends and things that will get, let go of the assumptions that things are going to get back to normal, because they're not. And so we have to have a longer term recovery vision and drive this fundamental change in how we work. So thinking about future planning, we want to pull out a tool that we like to use a lot in strategic foresight, or future backcasting, it can be called. And so that's how we're going to set this stage with this question to the first two panelists, Eliza and Biraj. The question, setting the stage, it's 2030, okay? And a decade has passed, and you're reflecting back on the year 2020, which was the catalyst for a lot of changes in how we work and engage with each other, and based on a lot of the examples the speakers have talked about. So thinking about that from the future, looking back, what lessons will we have learned that will ultimately shape how we engage with or work within healthcare, to Biraj, and then also our city government, to Eliza? So Biraj, would you like to start?
Sure. So I think this is an interesting question, because if you go back 10 years from now, if we are in 2030 and I look back, I think the first thing we'll say, remember 2020, and everyone will say, no, I don't want to remember 2020. But I think the point everyone is making is that there were so many problems that were exposed, at least in the healthcare side I can speak to. I know there are many other industries who sort of saw a similar trend. But the bigger problem, I think we can look back and say, imagine that time when people actually couldn't go to an hospital and get treated. Imagine, we were in 2020 and there was a period of about 3 months where people couldn't get a surgery done. Imagine, when we were in 2020 and, we weren't prepared for a pandemic. And I hope that we are in 2030 and we are seeing that has changed. That has changed, I think, in a way where the one focus we have to understand is I hope that we have moved from more like an insurance-centric patient care model to more of an empathy-based model, where it's not so much important where do you have the insurance authorization to get treatment versus does your physician and your care team and do you have empathy where you can go to the next level. So I think that would be one. I think the second thing hopefully we'll have in 2030 is healthcare becomes a journey more than what we have today is a series of episodes. So I'm sick, and then I get better, and then I go away from healthcare or my personal health, and then I come back to it the next time when I'm sick. So I think hope we are in a situation where people are actually being less into the hospital because they are so much more proactive about their own health. I think the third one, and this is what our CEO has been, Dr. Steve Klasko has been talking for the past 4 to 5 years, is that we should get to a model where it should be healthcare with no address. I think today a lot of people weren't able to get care because I have to physically go to a hospital or to an outpatient facility to get care. But I think what this pandemic has done is it it has put the conventional business models of healthcare or any other industries and turned it upside down. And people are right now thinking about new and better business models. And so I think we hopefully will have a business model where we are able to say that healthcare is moved out from the four walls of a hospital more towards where the patient is. So the care is where I am versus I go to where care is. And I think so. I think looking back, empathy would be a big thing. Do we have healthcare with empathy? Second, I think, do we have healthcare where I don't have to physically travel, especially in Philadelphia or those in Chicago, in brutal cold, just because I'm feeling sick, to a hospital, versus how can care come to me? And I think the last one is just thinking about, how do we change the way we fundamentally think about healthcare, from being an episodic journey to more of from being single episode to a more of a journey. And those who are interested in what the future might look like, Dr. Klasko wrote, and Hemant Taneja, who's one of the VC entrepreneurs from Silicon Valley, recently wrote a book called Unhealthcare, and where they talk about, it should be more about health assurance versus health insurance. So it's a pretty small but very interesting book. I think for me, those are some of the kind of key things that I would look back in 2030.
Great. That's awesome, Raj. And as a graduate of Jefferson University in grad school, super excited that Stephen Klasko and yourself are putting design and empathy in the front of how healthcare is evolving. And then also, I just see it in Philadelphia in general, being a Philadelphia resident, of how, healthcare is very human forward, and we're shifting that way. So, it's an exciting point that you as a leader in the organization are having that kind of view of where the future will hold. And I think some of us as consumers and Philadelphia residents in the area are definitely eager for that shift. So, hopefully we can help make it there. So I think we're having a little technical difficulties here. Eliza might have dropped, unfortunately, but this is the reality we're in with the disruptions and online. So we're going to roll with it.
I think that's what we were talking about just a few minutes ago. About you have to embrace these things. That's the reality. But hopefully, when we are in 2030, we are saying that we're somehow able to teleport her wherever we need her to, so she can still be there, or we could go to where she is, so we don't have an issue. But interesting enough, you bring this, that I don't think it's just healthcare that is going through this transformation. I think definitely there are other industries. I'm sure airlines are right now thinking, what's my business model that's going to change? Because I think one industry that got really severely hit, at least in the beginning, were the airlines. And I'm sure other industries, restaurants are going to try and be more innovative as well, because if I am into a situation like this ever again, how am I going to react to that where I don't lose business? I think really that's something that we'll need to, but it'll be interesting.
It really is. And so with that, I think we're going to switch over to Marissa and the other panel, and we can see after that discussion if Eliza can jump back on. So if we could switch to Marissa, Lori, and Shante, that'd be great. Thanks, Raj.
All right. And am I on? Can everyone hear me?
We can.
Okay. We just got an email from BPHL. There's actually issues with the app right now because of all the sessions happening. So I think that's what's happening. So we're all here though. So yeah, I just wanted to go ahead, kind of feeding off what Brady was saying, what the other speakers were talking about, particularly honing in on the importance of more robust engagement processes right now. I think a lot of the speakers spoke to more robust processes that allow it to then be more equitable and more inclusive. I really liked Shante. I think you used the phrase, the art of the possible, as a way to describe how you have to kind of reimagine and rethink how proper engagement can work at this time, and how we can really bring people on board and make sure that people feel part of figuring out the problem and the challenges and part of figuring out the solutions. So I guess what I wanted to ask, maybe Shante, you can take it first, then Lori, but what have you been seeing as to maybe another couple of new tools that you've been using recently, whether that's, again, remote in terms of not virtual, or if it's more virtual tools that have been working to enable you to be more equitable in your engagement processes. And then alongside that, when you're doing these kind of more comprehensive engagement process that you have to do, and when you're shifting, what kind of impact are you seeing? So what do you feel like the importance of engaging people is, and how do you see that impact in your work? It's a two-part question, so take whatever part you want to, and go ahead.
And I wrote it down, so hopefully if I miss something, you can course correct me. So I'm going to take it from a slightly different angle. So at Amazon Web Services, again, our job is to provide new and modern technology, cloud technology, to the governments that I am working with, the government leaders. And so I want to just talk about, not by name, but just some of the types of services that we're now working with, and talking about how that is made, which I think your second question was the impact. So I'll start with first, as you can imagine, with COVID-19, just like private businesses, governments also had to send everybody home. But yet they don't have the luxury of waiting a week or waiting a time to get servers up or get equipment, get a laptop to everybody. People still need their health care benefits. People still needed to file for unemployment. People still needed, to go get tested and so forth and so on, which may be from a, state-run hospital, so forth and so on. People still need their benefits to be able to go purchase food. And so what we were able to do is show them how that technology could expand and maybe better utilized within their government entities. People weren't able to come downtown anymore. So what happens if you have to come downtown to get a driver's license because you needed to do something else and your driver's license is expired? And the DMV either isn't open, or they can only allow 20 people at a time into the lobby because of social distancing restrictions. So what we've been able to do is use our technology that we have in cloud. And a lot of people sometimes just thought of cloud as data migration, right? But no, we actually help with some of these social services. And we've really been able to work with our government customers to help, like you just said, reimagine how we can actually function differently. We have some where we're working in Rhode Island and the state of West Virginia, where they're making it a different experience for unemployment insurance. That's a time where people are very stressed. We've had people apply for unemployment right now across the country that would have never thought that they would have had to apply for those benefits. And so now they're able to get those benefits online, more seamless, and have a better experience. So I think that's how we're really working with, again, I know it's a quirky term, but the art of the possible. How do we figure out how we can actually still operate when we can't come down, either downtown or to the Capitol building and so forth and so on. And the beauty of that is now we're seeing it play out long term. Governments are thinking, hey, and I think that's your second question, is your impact. We're now able to make a long-term resiliency impact where people are starting to say through government, wait a minute, this can be long-term. DMV doesn't have to be a bad experience anymore. Now we can make it where you can go on your phone or ask Alexa, what's the wait time at the DMV? And so instead of getting in your car and having to go and sit in line and be there all day, now you can figure out what's the best time for you to either go to the DMV, or because of the technology that we've helped governments implement, they can actually do some of their services now online. So they don't even have to go downtown to that government agency to have the interaction that they used to have. So I think that the benefit is, again, it's helping figure out there are different ways to do things than we've done them for the last 30 years.
Yeah, I think it's a weird silver lining of all of this time that we're experiencing. And to connect the dots, we always talk about the phrase, meeting people where they are and how important that is, even pre-COVID. But I think now, like what you're saying, we're really realizing what that means, the extent to which we have to meet people where they are, as the different situations are being exacerbated during this time. So in a way, it is forcing that more tailored approach, the more kind of human-centered approach to how we're redesigning all these processes, which, yeah, hopefully they're actually here to stay, especially if we can track the impact of them and see the difference. Yeah. And how about Lori? Kind of similar question for you. I know you talked about this as well a little bit, but how are you kind of reworking to reimagine your kind of stakeholder engagement techniques right now? I know you spoke to a few, but if you can speak to another one maybe, and also the impact that you're seeing too.
Sure. And I think for us, we're still in the early stages of sort of what is going to be this new type of engagement with our stakeholders, because again, we have different stakeholder groups, and so we are having, we've done this thing over the last 6 months, but now we're actually kind of stepping back. It's like, what is going to be the long term for this work? Because it's going to keep in this mode, whatever it may be, and I'm saying it because I think it's going to be different depending on which stakeholder group at which time. And it kind of goes back to somebody who just said meeting the individual where they're at. If I have individuals who may not have access to technology, how we're going to provide services and support that stakeholder group is going to be very different, even in the future. And hopefully it gets better. But I don't know, 10 years out from now in 2030, I would hope that everybody has the hardware and the software and the connectivity to do what needs to be done. But and that would be my hope, that one of the things that really comes out of this time is that we really make the effort to make sure that everybody does have equal access. And that goes back to the thing about equity and inclusion. We need to be including everybody in this, because other than that, we do have different classes of individuals accessing services or supports in different ways. So I think that, I think we're still looking at sort of how we're going to be using those, because for us, technology is really big. We had teams that, were, using laptops and cell phones to sort of get their work mobile, to really meet people where they're at, many years ago. So we were really at the forefront of that as a not-for-profit, and we want to continue to do that. We are working on an integrated healthcare platform for our members where it will be member-centric, where you as the member will really be controlling sort of your healthcare, having that dialogue, sort of feeding off of what Raj talked about. So those things that are in process. And so it would be my hope in the 2030, these things will really be working really robustly, and that we're continuing to get feedback from all of our stakeholders around this, including our government contractors and our funders and others who support our work. Well, some of the things that we're doing now, though, is it's really in partnership, for example, with the city. We actually do behavioral health assessments prior to COVID behind the walls of the Philadelphia Department of Prisons. And we actually would have staff go on site to do that. We are now doing that by phone and by Zoom. And I must say, I loved when we could schedule. I've seen how my staff can schedule their appointments to do the Zoom meetings behind the walls of the prison. That's phenomenal. This takes work in a totally different direction and really allows you to engage people at times and opportunities that we didn't have pre-COVID. We started off with phones first, and then we moved into Zoom in the last 2 months. So that's really been a big shift on how we're doing work, and will allow us and our teams to engage people in a way that we haven't been able to engage in the past. The other thing is that we work very closely with the court system. So the court system has been having virtual court hearings. So again, Shantae talked about coming downtown to get your DMV. You may not have to do that. Now people are actually having virtual court hearings. They're joining by Zoom. They're joining by phone, to really reduce, people having to come on site to the Criminal Justice Center or to family court to take care of what needs to be taken care of. It's a definitely, and in talking about this is real coordination, collaboration between all the stakeholder groups. We get somebody who's providing the services, the courts who are actually running the courtrooms. What does this look like? How will this work? Getting the technology in place to do it, and it's working. So I see more of that. I can see much more of that work continuing in 2030. So these are some of the things that I really see happening both now and into the future.
Great, thanks for that, Lori. There's a lot going on. It's really exciting to see and to hear about it. I mean, it's kind of one of our other questions that came from the audience and also from ourselves ahead of time, was just the idea of including all voices, and like what you're talking about, how you're having to juggle and really work with this variety of stakeholders. Is there a particular tip you might give someone for how to balance that all and how to get people collaborating really across sectors like that you're, I know it's a hard problem. Complex.
It is so complex. I can't just say just level of communication. I mean, in the early, when we first started, going into this remote work, to go to Shantae's point, I have never worked so hard in my life. It was just the constant communication, really keeping everybody informed, on the same page. And really, and for me, and when I'm working with folks, what's the ultimate goal? The ultimate goal is that I want to basically be able to support that member, whoever that stakeholder is, as best possible. Because I think that then takes down some of the walls of distrust, which can be a barrier, barrier. I think it takes down some of the apprehension about what can happen. Let's keep our focus on where our goal is to really support whoever that, key stakeholder is in terms of trying to do whatever we're trying to do. I think that, from my perspective, has really worked well at this time. But it's really a lot of over communication at this point, because I think in the end, it really has aligned a lot of trust that may not have been there in the past because we've done that.
Yeah, I mean, I think there's that whole, it's all about building trust, and this is even more about how do we rebuild it and keep building it in this new world. I'm going to turn it over to Brady now. He's going to start just an audience-driven Q&A. So we've been getting some questions in. So here's Brady with the first one.
Great, thanks. So before, just to give to the audience, Eliza had to drop. Unfortunately, her computer crashed. This is the fun environment that we're in. But if anyone's interested, she texted me and said, you can reach out to her and continue the conversation, eliza.pollock@phila.gov. So we sourced a couple questions from the audience, and I thought this one was actually the first question, kind of flipping the hat on our conversation a little bit. So I'll offer this to the panel. So while we define this as how we work, and a lot of our conversation's been about how we're working and engaging, do students, patients, customers, constituents, or stakeholders recognize it the same way? So meaning, we say the business talk how we work, but do our end users, the stakeholders, think about new ways of receiving the service and care? And so the audience, if so, maybe how are you getting these insights from the stakeholders? So, Viraj, Shante, Lori, anybody want to jump in first and give an example there?
Yeah, I can speak to it. I think it goes back to communication, because what we learn is that when you're working with patients or in general customers, everyone comes in with some type of a different expectation of what I expect from this service. So I think clear communication as to what you're going to deliver, and then making sure you deliver to that promise is important. We acknowledge pretty quickly that having people in the waiting room is probably not going to be a good idea. So how can you start minimizing the amount of wait in a physical waiting room? So we started working with a pilot project right now that is looking at virtual waiting rooms, and minimizing the amount of things that a patient needs to do in their visit. But we had to work really hard to make sure that people understand that this is still a pilot. This is something that we are trying, and we are going to get better at it. This is not a solution. And we also were clear in communicating that we are going to learn as much from you as much you are going to learn from us. So this is not something where if there is something wrong, we would really appreciate if you tell that to us, because if you don't tell that to us, but rather if you tell that to, on a Yelp or a Google, we will still hear it and we will still do it. But I think let's make it a process where we get to a point where we try and deliver the best service that we can. And healthcare now, I think, has realized that it's more about customer service. I think delivery of care and good care is a given. I think if I go to a hospital, I'm expecting that I'm going to get the best care or the best outcomes, but it's the layer of experience that I'm going to add on top of that that's going to differentiate between. So I think include your stakeholders into those conversations to make sure that you hear from them.
Yeah, and I'll jump in on the tail end of that. So we have the advantage of people use Amazon.com, right? They can get a couch, a mop, and some toothpaste all in 2 days. In probably maybe the same order. And so when we've been working with government customers, they've been saying, we want to be able to provide the same service that constituents are already getting from private companies. And so I think that is, again, where we had a different dialogue about stakeholders, and actually realizing who your stakeholders are. A lot of times we don't really, and I was in former government. I was in government 20 years before I joined Amazon Web Services. And even I had to train myself about who are my real stakeholders. And I think that is something that, again, putting yourself in the shoes of, if I had to go downtown or if I had to go to my state agency to do this type of service, how would I want it to be more efficient? And I think that is one thing that we've been able to say is, okay, we got to put ourselves in those shoes. And I know I was guilty of it when I was on the other side of, sometimes doing services that maybe didn't align, but now we're actually changing. And I think that's becoming more of a conversation about, dealing with the stakeholders and dealing from their point of view.
Awesome. Shantae, really appreciate the comments. We're at 2:00 now. I did see Eliza pop back on, so I just want to say, hello. I did share your contact information, so you might get some people reaching out to you.
If this had been on chart paper, that wouldn't have happened.
And a location change. I love it.
Yeah. We're in the living room. Okay, sorry.
No worries. But I just, it's 2:00. I mean, there's a lot of other activities going on. So I just wanted to say thank you to our speakers for the engaging conversation and for the attendees for joining us today. Hopefully you learned some about how leaders in these organizations are, shifting their organizations and engaging people in different ways. Please reach out to us, follow us on LinkedIn. We're all on LinkedIn and active. So we hope that this is actually a catalyst to engage with each other, to continue these conversations, because we need to reach out outside of our reference bubble to learn, gain insights, and to continue to push what the norm might be into the future. So Marissa, any other closing thoughts on your end?
Oh yeah, I just wanted to echo that and say thank you, and let's collaborate.
Great. Thank you, everybody, and enjoy the rest of BPA Fest.
Thank you.
Bye.
Thank you. Bye-bye.